For decades, the people who run airlines have been obsessed with a single, almost invisible enemy: weight. They have removed olives from in-flight salads to save a few grams per tray. They have weighed individual sheets of paper. In 2018, United Airlines switched its magazine to a lighter stock and saved an estimated 170,000 gallons of fuel a year. The savings from that single change came to roughly $290,000 annually. To an industry this large, that was a victory worth celebrating. And yet, the one variable they could never touch, the one number that mattered more than every olive and every page combined, was the weight of the passengers themselves. That was simply out of their control. Until, very recently, it wasn't. In January of 2026, the investment bank Jefferies ran the numbers on what would happen if the average American passenger simply became lighter, and concluded that the 4 largest US carriers stood to save around $580 million a year in fuel. Not from a new engine, not from a redesigned wing, from a drug. A medication originally developed to manage diabetes was, quietly, beginning to reshape the economics of flight itself, and the airlines were only the beginning. The same molecule was bending the grocery aisle, moving the stock prices of medical device companies, and, improbably, distorting the entire economy of a small northern European nation. One product, designed to quiet a single, ancient human signal, the feeling of hunger, and in quieting it, beginning to rearrange the machinery of global capitalism around the absence of a craving. So here's the question worth sitting with. What happens to an economy that was built, brick by brick, on the assumption that human appetite is infinite, when, for the first time, that appetite can simply be switched off? To understand how a weight loss drug could ripple all the way to the wing of an aircraft, you have to begin somewhere far more ordinary: a grocery store. Because before any of this reached the markets, or the airlines, or the treasury of a foreign government, it showed up first in the most mundane place imaginable: the American shopping cart. By late 2025, roughly 1 in 8 American adults were taking a GLP-1 medication, the class of drugs sold under names like Ozempic, Wegovy, and Zepbound. Counted by household rather than by person, the number climbs higher still. Nearly a quarter of all US homes now contain at least one person on the drug. And the projections only bend upward. By some Wall Street estimates, more than 30 million Americans could be taking these medications before the decade is out. What makes that figure economically radical isn't the prescriptions themselves, it's what the drug actually does. GLP-1 medications work, in part, by quieting the body's hunger signal, the ancient biological hum that tells you to eat, and then to keep eating. And when you quiet that signal across tens of millions of people at once, something happens that, as far as the data shows, has never happened before in modern American history. People simply eat less. Surveys of users find them consuming 20 to 30% fewer calories a day. They drink less alcohol, reach for fewer sugary drinks, and, for the first time on record, the average number of calories consumed per person in the United States actually fell. For an economy built on selling food, this was not a minor adjustment. It was a tremor at the foundation. And in late 2025, researchers at Cornell University put a number to it. Tracking the grocery purchases of more than 2,000 households after they began taking GLP-1s, they found that spending on groceries dropped by an average of 5% within 6 months. And among higher income households, the ones who could most easily afford the drugs, that decline reached more than 8%. But the truly revealing detail was in what people stopped buying. The cart didn't shrink evenly. Savory snacks, chips, crackers, the things you eat without ever really being hungry, fell by more than 10%. Sweet baked goods slid. Spending at fast food chains and quick service restaurants dropped by 8%. The categories that depended not on nourishment but on impulse, on craving, on the very appetite the drug was designed to silence, those were the ones that bled. And there was a quiet, almost poetic discovery buried in the data. When people stopped taking the medication, their old spending returned. The cravings came back. The cart refilled. Appetite, it turned out, had not been cured. It had merely been switched off, and it could be switched back on. For the corporations that feed America, the math was sobering. By some projections from JP Morgan, the packaged food and beverage industry could lose between $30 and $55 billion in annual revenue by the early 2030s. And so, behind closed doors, the giants of the grocery aisle began doing what threatened industries always do: shrinking portions, repositioning toward protein and fiber, and quietly bracing for a consumer who, for the first time in the history of modern capitalism, could simply be made to want less. But the grocery aisle was only the first domino, because a drug that changes how much a person eats does not stop at the checkout line. It reaches outward, into industries that have nothing to do with food at all, and whose fortunes, it would turn out, were quietly tied to the size and the hunger of the human body. The airlines were the charming version of the story. A slimmer society, a lighter plane, a few $100 million in fuel quietly saved. A curiosity an analyst could write up with a wink. But in other corners of the economy, the very same force was arriving not as a curiosity, but as a threat, capable of erasing billions of dollars in value over the span of a single afternoon. To understand why, you have to see what obesity had quietly become. Not only a health crisis, but a business model. Entire industries had been built, brick by brick, on the downstream consequences of a heavier population, and their revenues depended, however uncomfortably, on those consequences continuing. Consider sleep apnea. Millions of people, many of them overweight, struggle to breathe through the night, and a company called ResMed built a multi-billion-dollar empire selling the machines that keep them breathing. For years, it was a reliable, growing business, and then, in 2024, clinical trials showed that GLP-1 drugs could meaningfully reduce sleep apnea itself, by treating the weight underneath it. Investors ran the math in real time, and ResMed's stock dropped on the fear that the drug might simply shrink the disease out from under it. But here, the story took a turn few expected. As the data matured, it became clear the drugs and the devices were never really enemies. Patients taking GLP-1s actually proved more likely to begin therapy, and the two treatments worked better together than either did alone. The headwind, almost overnight, became a tailwind. The threat had been real, but the market had misjudged its direction. The dialysis industry was not so fortunate. Companies like DaVita earned their revenue treating kidney failure, a condition driven heavily by diabetes and obesity, the very conditions these drugs were designed to fight. And in October of 2023, Novo Nordisk announced it was halting a major kidney trial early, because the results were already so strong that continuing it felt unnecessary. The drug, it seemed, could protect the very organs the dialysis industry quietly depended on failing. The reaction was brutal and immediate. In a single trading session, DaVita's shares fell 17%. Its largest rival fell nearly 18%. A major maker of dialysis equipment dropped 12%. In one afternoon, the market repriced an entire industry around a single, uncomfortable possibility: that a generation of patients might simply never grow sick enough to need it. This is the strange, double-edged nature of a drug that makes people healthier. For the patient, it is salvation. For the balance sheets quietly built upon their illness, it is an existential question. And if a single medication could do this to industries, to airlines and snack makers, to device manufacturers and dialysis chains, then a far stranger question loomed just beyond them. What happens when that same force grows large enough to bend not a company, but an entire nation? To find the strangest consequence of all, you have to travel to a small, prosperous country at the top of Europe, Denmark. A nation of fewer than 6 million people, long known for its bicycles, its design, and a quiet, stable economy. And more recently, for being home to Novo Nordisk, the company that makes Ozempic and Wegovy, and that became, almost overnight, the most valuable corporation in all of Europe. What happened next has few precedents in modern economics. In 2023, Denmark's economy grew by nearly 2%, a respectable figure in an otherwise sluggish Europe. But when the National Statistics Office looked closer, they found something unsettling. Strip out the pharmaceutical industry, and the Danish economy would not have grown at all. It would have shrunk. The International Monetary Fund put the dependence in even starker terms. By its accounting, the pharmaceutical sector was responsible for roughly 90% of all of Denmark's economic growth in 2022, and about half of it the year after. By 2024, Denmark posted the highest growth rate in Europe, outpacing Germany, France, and every other major economy on the continent, driven overwhelmingly by a single company selling a single class of drug. Meanwhile, the spending of ordinary Danish households barely moved at all. It was, in a sense, a mirage of prosperity, a national economy that looked like it was booming, when in truth, one extraordinary company was carrying nearly all of it on its back, while the rest of the country stood roughly still. And an economy balanced so precariously on one firm is a fragile thing. The danger is not theoretical. In December of 2024, Novo Nordisk released results from a closely watched trial of its next-generation weight loss drug, and those results, while still strong, fell short of what investors had been hoping for. The stock collapsed by roughly 20% in a single day, one of the largest single-day losses of value in European corporate history. And on that very same afternoon, something remarkable happened. The Danish krone itself wavered on the global currency markets. Sit with that for a moment. A single disappointing clinical trial for a single weight loss drug was enough to move the currency of an entire nation. As one Danish economist put it, with no small amount of wonder, it may seem strange that weight loss medicine affects interest rates in Denmark, but it does. This is the scale at which we now live. A molecule designed to quiet a feeling in the human stomach had grown large enough to tilt a national economy, to move a sovereign currency, and to make and unmake the fortunes of millions of people who had never taken the drug at all. So we return at last to where we began, to that quiet question left hanging in the dark. For as long as there have been markets, they have rested on a single, unspoken assumption that human desire is endless, that we will always reach for more food, more comfort, more of everything. An entire civilization of commerce was built on the wager that appetite could never truly be satisfied. But for the first time, that appetite can be turned down. Not by willpower, not by scarcity, but by a weekly injection. And as it quiets, in the grocery aisle, in the dialysis ward, on the wing of an aircraft, in the treasury of a small nation, we are left to wonder what else, in an economy built entirely on wanting, might fall quiet along with it. And that's about where I'll leave it. If you made it all the way to the end here, thank you, genuinely. Videos like this one take a while to research and piece together, and the fact that you stuck around for the whole thing honestly means a lot. This channel's still early in making videos like this one, so if it's the kind of thing you want more of, subscribing actually helps the next one happen. Either way, I'm glad you're here. I'm Morgan, and I'll catch you in the next one.